Welcome to another edition of the Wound Care Window. Several weeks ago, we introduced you to a new technology developed by Kent Imaging. This is near-infrared spectroscopy. We used near-infrared spectroscopy to evaluate tissue perfusion by comparing oxygenated versus deoxygenated hemoglobin. And we used that and showed you the illustrative case of how we can use near-infrared spectroscopy or the Kent technology to evaluate a patient with hyperbaric. We're going to do something a little different today. Here we have a patient that requires a wound debridement. If you look at this venous ulcer here, there's a fair amount of inflammation around the wound, a lot of fibrin, exudate, and necrotic tissue. We're going to use ultrasonic debridement to try to clean this wound up. Just prior, we shot an image on our Kent camera, and what you'll see from this image is that she has reasonable tissue perfusion and oxygenation outside of the wound margins. All of this red and yellow tissue here clearly illustrates excellent perfusion. But if you look at the center of the wound, our values are fairly depressed, in the 40s, certainly not better than 50%. So that indicates an area of inadequate tissue perfusion, inadequate oxygenation. What we're going to do here is debride this wound with ultrasound and see if we can get a difference between the pre and the post debridement to suggest that we've made an improvement in tissue perfusion. Why would we be getting an increase in tissue perfusion with debridement? Well, this is a technology called Arabella. It is ultrasound guided debridement. And Arabella not only allows us to debride the wound with ultrasonic energy, but the energy has also been shown to be stimulatory for increasing tissue perfusion, as well as increasing cellular processes like fibroblast proliferation and angiogenesis. So let's see how this works today. The Arabella technology is delivered to the wound through this debridement device. You see Arabella has a curette type structure at the end. We take a handpiece, we attach it to this tubing, and what this does is delivers saline through the handpiece. The saline is energized by the ultrasonic energy, and that energized saline is what we use to actually debride the wound. Ultrasound debridement accomplishes several things, cavitation as well as acoustic streaming, and we're going to talk about that. So we have the device set up. I'm going to allow some of the coupling solution to go through the device. And once we have a drip rate of about 3 to 4 drops per second, we go ahead and turn the device on. What you'll notice is that the saline is being energized, and this is how we debride the wound. So we're going to go ahead and treat the wound. Now, it's important when you're debriding a wound like this to cavitate the tissues. What do I mean by that? Take the ultrasound probe and sit in one spot on the wound for a period of time. What that does is it causes a fibrinolysis, a proteinolysis, and allows that slough to be removed from the wound base itself. So again, what I'm doing is I'm sonicating the tissue first, using the ultrasonic energy to loosen the tissue, and then I come back through with the edge of the curette and try to scrape some of it off. So, two properties, the physical properties that we're treating this wound with is number 1, acoustic streaming, and number 2 is the cavitation. So when patients are having tenderness, what we can do is we can put this device into the pulse mode. This gives us a burst of energy intermittently. You see that's being pulsed right now. So now what we're going to do is we're going to shoot another picture of the wound and see if we made any difference here. This is the after image. If you'll see in the central part of the wound, we have actually stimulated that tissue. There is certainly much more oxygenated tissue that's evident. So here's an example of the pre and post. Again, nice improvement in tissue oxygenation following the debridement to suggest that we are actually getting some enhancement of the tissue when we perform ultrasound guided debridement. This is Brandon Hoffman. He's one of our medical assistants here. He's well trained in this technology. Brandon, why don't you give our viewers just a little insight as to what near-infrared spectroscopy is and how it works?
Near-infrared spectroscopy is based off the principle that light is absorbed and reflected differently among oxygenated and deoxygenated hemoglobin. That camera uses a flash of near-infrared light and then it measures the amount that's reflected and generates a computer model, where an interactive computer model where you're able to tap parts on the screen that show the amount of tissue oxygenation present.
Well, we hope you've enjoyed this edition of the Wound Care Window. Again, here at AZH, we try to bring you cutting-edge technology and to show you how this technology can enhance your clinical outcomes and provide excellent patient care. Thank you.